Okay, now what is this treatment doing?
Okay, so this is called Firefly, and as I mentioned when we were doing the F-scan, we run the F-scan first to generate a frequency associated with a certain bug, parasite, bacteria, or virus that we'd like to treat. And so given the F-scan, we have the frequency. We've now programmed that into my father's and I Firefly machine. And what the electronics inside the Firefly are such that we're not just running one frequency, we're actually running what's called sidebands. So if you look at a spectrum analyzer, there's one peak where that frequency is, but then there's thousands of these sidebands. And the reason we're able to accomplish what's been going on with treating patients once and having them pass, I think, is because if we don't get it with one sideband, we're going to get it with another. So we talked about resonance and the theory of resonance where you're vibrating and then to internally destroy something. Well, if you're just running one frequency, you have to be right on it. But if you're running thousands of different frequencies, you have a much better chance of eliminating the pathogen in one fell swoop. The light, you could do this possibly with, sound is too low, but you could possibly do this with magnetic pulses. And it's just, the light is the energy delivery system. But the frequency information in the light is what's actually causing the vibration. So the typical treatment is 10 minutes over the abdomen for bugs and 10 minutes over the lungs and chest if we see upper respiratory. Most people have problems in the gut. Okay, so a couple frequently asked questions for you. If we're doing this frequency therapy over the abdomen, a good question is how do you know you're not killing my good bacteria? Well, we're not, since it's frequency specific for the patient, we're avoiding those frequencies that would kill the good bacteria. And I know because after hundreds of treatments, some patients are reporting some diarrhea, but it's only for about a day or two. And if we were killing the good bacteria in the gut, they would have problems with their gut for a lot longer than that. And they're not, and most of them are not supplementing with probiotics or any fermented foods or anything like that. The other question that comes up is how many treatments. As I did mention before, it's usually a course of 3. We are seeing a lot of results after 1, but just to be sure, I would say 3, and then at least recheck with the F-scan to see how it's changed. And about 80% of the time, the F-scan is way better. It's even getting rid. Let's say a patient comes up with 4 different bugs at 4 different frequencies. We can't treat all 4 at once. We're treating 1 and the associated sidebands with those. Well, I think what that's allowing to do when we kill that one is the immune system to be strong enough to go to kill the other one. So oftentimes we're eliminating a lot more than just one particular bug.